Hello, Dr. Wong. Nice to see you again. Dr. Wong is the infectious disease specialist. And since last time we talked to you about this new COVID-19 virus, previously you had said that the virus maybe mutate and go through different generations. It may become less and less strong. But now, what do you think? Is it become less and less infectious, or less and less strong, or?
Yeah, it has been a while since we talked about this virus, and I think now the evidence is gathering that the virus has a certain mutation which enable it to be transmitted more easily.
Okay.
Meaning the virus load, the amount of virus which exists in the nose before someone has symptoms is higher than previously. That will mean that person can transmit the virus to another person more easily.
Okay.
And but up till now, there's no evidence that this mutation will make the virus more virulent, meaning that it will cause more death or more severe disease.
Okay.
It's just making it more transmissible.
Okay.
Usually, it's like that. When a virus become more transmissible, there will be more mild or asymptomatic cases.
Okay.
Because it's very the so-called mild case will facilitate the spread because they won't be hospitalized. They will be walking around, and so. But it will also make the control more difficult because most of the people, as compared to SARS, when we can use a fever as a triaging criteria, anyone with fever we can check whether they have SARS. But now, where can we find those people? Because many people, they not even talk about fever. They don't have symptoms.
Okay.
But actually, many authorities said there are certain symptoms, but very mild ones.
Okay.
But just that people may ignore them. For example, some muscle ache or some fatigue, or sometimes change of smell or change of taste. People might think that is very trivial and that they may ignore it, but actually there are some symptoms.
Okay. So now I've heard some other people talk about if you're fatter or bigger, you're more likely to have more harsher symptoms or be hospitalized to catch this virus. If you're fatter, your BMI is higher, is it easier to catch it?
Okay. Yes. There are some research coming out. Of course, we know the traditional so-called high-risk factors for severe COVID-19 include old age and people with underlying medical illness, including those of the lungs and the heart and or other organs, or the with the immune system immunocompromised. That is very understandable because during this COVID, for example, the body will have less reserve because of the lung infection, and then when you are tilt towards the straining the lung function, and then there will be more complication, and so is the immunocompromised. They are less capable of fighting the virus. But it was found that there's another factor which occur also in the young people, which is obesity. Okay, it was found that the people who are obese, meaning that, for example, the body mass index over 30 or above, they are more prone to severe disease. Okay, and for example, for people who are obese, they are 3 times more prone to severe consequences of COVID infection. Those with obesity together with fatty liver, they are even at 6 times the higher risk to have severe consequences after they contract COVID. The reason why, well, of course, no one knows, but there are certain postulations. One is, of course, people with obesity usually they have a more abdominal fat, okay, and such fat they may push on the lungs, and then will cause the reserve for the lungs will be less when there is infection, okay, and so they cannot breathe so easily, so as to say. And the other factor is now fat cells. They are like pro-inflammatory. They are more prone to inflammation as well. So as I've talked about, for people with severe COVID-19, usually in the second week of the illness, they are experiencing something like cytokine storm. Okay, their body is reacting excessively to the effect of the infection. So the presence of more fat cell will prone a person to more inflammation. So it was the postulation why obese people are more prone to such a severe consequence. That is the postulation. But the observed phenomenon is that they are really at high risk. But that is not something very new. Actually, was found also in SARS, as obesity also found to be a risk factor as well.
Online, we see some people who are also fit that also catch this COVID-19. Is there any reason for them? Is it maybe they have underlying symptoms or they're too fit?
Okay, actually, for COVID, as long as you don't have the antibody and as long as you have not been exposed before, you are prone to be infected if you get in touch with someone with COVID. That is the first principle. But whether you will develop severe symptoms will depend on a bunch of factors, including your own immunity or your age, or whether you have underlying risk factor, and also obesity for that matter. Okay, and yes, they are. Everyone is susceptible. No one is immune.
Yeah. So right now, to protect ourselves against COVID, besides washing hands, social distancing, wearing masks, as well as trying to keep fit or trying to bring down your body fat, so less likely to have severe symptoms if you do catch it. And so that's all for today, Dr. Wong. Thank you very much.
Thank you.